Welcome, everyone. We'll just give folks another minute. They're traveling through cyberspace here. All right, welcome everyone. I am Jamie Strauss-Clark, your facilitator. This is I believe it's our 5th CRIS committee meeting, believe it or not. So very nice to see all of you. We have, as ever, a pretty action-packed agenda, so we're going to get started right away. But before we do, I just want to walk everyone quickly through the tech. I know you've seen this spiel before, but it's been 2 months since we've seen each other, so I think it's always good to refresh our memories about how we're going to conduct the meeting. So Nicholas is going to share the screen and walk us through. We'll go through the slides here. So let's go up to slide number 2, Nicola, when you get a second.
Thank you. I'm just moving it into slideshow.
Appreciate it. Thank you. Perfect. All right. So as a reminder, I have 2 slides here on this. One is for our CRIS committee members, and the other is for our guests and community members who are joining us today. So CRIS committee members, if you could please keep your mics on mute unless you're speaking. That's that button with the arrow pointing at it on your toolbar at the bottom. But if it's available to you, if you have the internet bandwidth and the mental bandwidth, if you could leave your video cameras on for much of the meeting, that really does help us facilitate, particularly when you go to breakout rooms. That's going to be important. You want to advance again, Nicola? We use the raise the hand function to indicate when we're ready to make a comment or ask a question. So you can click on that reactions button and it pops up the window. Click on raise your hand. If you get confused and can't remember where it is in the moment, backup plan is you can wave your hands and I'll try to catch you either way. Can advance the slide. There we go. Okay, for chat today, steering committee members, you can chat me directly if you have a comment or question and you'd rather communicate it in written form rather than verbal. Please chat me directly, Jamie Strauss-Clark. You can find me in the chat list. If you're having any technical difficulties or technical questions, you can send a chat directly to Brittany Thompson and she'll be able to help you, or she'll do her best to help you. Next button. Speaker view, if you would like to see as many steering committee members, or excuse me, CRIS committee members as possible, click on that speaker view and then indicate gallery. And that will allow you to see the full array of folks, especially when we're not sharing our screen with slides. Click ahead, please. All right, let's click to the next screen. All right, so members of the public, guests today, thank you as ever for being here. We really appreciate the time that you take to observe these meetings. We have a slightly different set of expectations for our guests. If you could leave your mics on mute, please. But then we're going to ask you to keep your video cameras off. And this is because there are almost 100 people on the call today, so it does allow us to isolate who are the CRIS committee members who are supposed to be participating verbally in the meeting versus our guests. There is an exception to that, which is we're going to move into breakouts and our guests are going to stay in the main room with me. I'll be facilitating a conversation with you, at which time I would very much welcome you to turn your video cameras on. You could advance the arrow. Speaker view, like similar instructions for our CRIS committee members, you can click on that and put it on gallery and see as many CRIS committee members as possible. Click ahead, please. I think that's it. Just a quick reminder about chat for our guests. I am not able to monitor the chat for your contributions during the main part of the meeting. I will be able to take a look when we're doing our discussion in the main room during the breakouts. So again, if you have any technical difficulties, you can send a chat to Brittany Thompson and she will do her best to respond. But otherwise, I'm not going to be able to monitor the chat because I'm going to need to stay focused on facilitating the conversation with the CRIS committee members. Again, the exception is when we're having our discussion during the breakout session. All right, we can go ahead and advance. Before I dive into the agenda for today and our meeting objectives, I want to pause and ask Senator Dingra to offer some words of welcome.
Thank you. Good afternoon, everyone. Thank you so much for being here with all of us and continuing the work of this committee. I always like to just start off by saying all of us here come representing different individuals, organizations, agencies, have our own personal journeys and stories that have brought us here. And what really unites us is in the vision we see for what the system can look like for the entire state of Washington. And this is the hard time. This is a time when all of us are going to try to figure out what that system looks like and what we want. But I just want everyone to kind of keep that vision being the true north, that is what we're all working towards. We're working towards it together. It is not about us wanting our particular piece of this process to be in a certain way. And I think we can all get there if we keep that vision alive. And I think so many of us, or most of us, actually share that vision. I really don't see a lot of discrepancy in that. So as we continue to do the hard work, as we are finalizing or moving towards final products or legislative priorities, we can just make sure we keep ourselves centered. That's what I would ask of everyone here. Thank you.
Thank you, Senator Dingra. A couple more housekeeping items I should mention. As you may have noticed, we have Lori Reinhardt here today doing ASL interpretation, and we have a second interpreter, ASL interpreter, who will be able, who you've seen before, who will be jumping in. They'll be switching off every 15 minutes. And I believe Brittany's pinning their images on the screen. So if you're using ASL interpretation today, they should be visible to you. Let's see. The other thing I wanted to mention is CRIS committee members, we're not going to do the round the room introductions like we've done at the first couple meetings. So I'll just ask, when you raise your hand to speak, if you could just briefly introduce yourself and the what you're representing on this CRIS committee. That'll help your fellow CRIS committee members remember who you are, and also it will help our guests and members of the public who are joining us today. And finally, you probably noticed when you joined, but this meeting is being recorded as ever, so be aware of that. Let's move on to our land acknowledgement, which is coming from Michelle Roberts with the Department of Health today. Michelle.
Yeah, good afternoon, everybody. I'm glad we are here together today. I want to share our land acknowledgement today and start by saying I'm currently located in Tumwater, Washington. It's on the traditional homelands of the Coast Salish people, specifically the Nisqually and Squaxin Island peoples. The Medicine Creek Treaty of 1854 removed Native peoples to clear the way for colonial settlement and the home I now occupy. The employees of the state of Washington participating today are guided by the Centennial Accord and Chapter 43, 376 RCW, respecting and affirming tribal sovereignty and working with our tribal governments throughout the state in government-to-government partnership. The Nisqually and Squaxin Island people have lived on and stewarded these lands since the beginning of time and continue to do so today. I want to recognize this land acknowledgement as only a small step towards true allyship, acknowledging dispossession and the history of the coastal Salish people. I am committed to learning and working to uplift the voices and experiences and histories of the indigenous people of this land and beyond. This includes sharing power and working together to improve health.
Thank you, Michelle. Nicola, would you put the slides back up, and I'll walk folks through our agenda, our objectives and agenda today, please. Thank you. All right, so our objectives today, of course, continuing to lay the foundation for collaboration with each other. You're going to be hearing a lot of updates. A lot's happened in the last 2 months, so there'll be a lot of updates to the CRIS committee, including an update on a learning trip to Arizona that was organized by Representative Orwell and Senator Dingra. Then we're going to spend our discussion time today focused on getting your input on that draft vision and guiding principles that the ad hoc vision work group, which is comprised of a subset of CRIS committee members, have been working on for the last couple of months. We'll do action items and next steps, and then we'll move into public comment. Can you advance the slide, please, Nicola? Thank you. So here's a view of how we're timing this out. We'll be moving into our personal story that we do at, we're doing one personal story at our CRIS committee meeting and another one at our steering committee meeting, which is happening next week on the 19th. Then we'll spend some time on CRIS updates, and in particular at 3:25, that update on the trip to Arizona. We'll take a short break. It's only 5 minutes today, so we can preserve time for our discussion. And then we'll come back together. You'll get some information from the ad hoc vision work group about that vision, and then break into smaller groups to discuss. And members of the public will be staying in the main room here and having the same discussion here. We'll come back together to do a share out and then do action items and next steps and move into our public comment period. We had 10 folks sign up for public comment today, and I'll walk through the how that's going to work when we get closer to that time. And now I also wanted to just offer a couple of quick updates before we move into our personal stories. First of all, I wanted to offer a welcome to Christina Felix, who is representing Tribal Behavioral Health today. Melissa Hurt-Moran, who was one of our 2 CRIS committee members representing Tribal Behavioral Health, has taken another job and left her position. So Christina is here joining us today. So welcome, Christina, and thank you for being here. I also want to let you know that HCA is in the process of identifying a new member to represent LGBTQ+ populations in behavioral health, because I believe Seattle Counseling Center is no longer in operation. So thank you for your patience as I walked through all of our agenda, and I think we can stop the share and move to our personal stories. And I'm going to ask Bipasha to make the introduction today. Bipasha, you're on mute.
Yeah, someday I'll get to
Thank you.
Hi, everybody. Building a better behavioral health crisis response system in Washington has to be grounded in the actual experience of people in our communities with lived experience. This is a foundational principle as set in the House Bill 1477 to guide the work of this CRIS committee. To that end, it was decided that every CRIS and steering committee meeting will have people from various communities in Washington state sharing their lived experience stories. These are stories that move us. They certainly move me, and they should. But we all need to do more than be moved. We need to move to action and turn these stories into accessible and equitable services for people across Washington state. To share experiences in our lives when we felt most vulnerable and maybe even broken is an act of deep courage in my world. And to take those experiences and turn them into a drive to change systems so everyone benefits is passion that can break down walls. I only recently met today's lived experience presenter, Melanie Estes, and the first thing that struck me was her willingness to be vulnerable and her palpable passion. Melanie is a human who is willing to share her story and, if need be, stir up some good trouble, as Congressman John Lewis said, to ensure the powers that be listen to people with lived experience and incorporate their suggestions into the statewide system we're all working on. Melanie is an MSW candidate at the University of Washington School of Social Work. She is a social work intern to Rep. Orwell. She's a mental health advocate committed to collaborating and building supportive relationships with people. She's also a volunteer with NAMI and Crisis Connections. Without further ado, here's Melanie with her story.
Hi, everyone. Bipasha, thank you so much for that very flattering introduction. I first off wanted to give a brief trigger warning. I will be talking in my story about suicidal ideation and suicide attempts. So if that is something that you'll need to take care of yourself for, make sure that you do that during my story in whatever way that you need to. So last night, I was having a hard time falling asleep, thinking about doing this talk today. And I was thinking about that common metaphor that's used when thinking about stigma around mental illness. People will say, you know, if someone had cancer, they wouldn't put off getting treatment. They wouldn't be ashamed to go get treatment. They would get it right away. And I think that we need to expand that metaphor to a systems level, because you would never have someone with a cancer diagnosis go to an emergency department and have them say, I'm so sorry. We just don't have any really like treatment options for you. And like your cancer is not bad enough to get a bed somewhere at this one treatment place. We as Washingtonians would not stand for that, as for that community. And I think all of us are here on this call today because we don't stand for that for folks with mental illness, and we want to do something about it. So I was diagnosed with bipolar disorder in 2007. And in the 15 years since my diagnosis, I've had, it looks like we're switching interpreters. So looks like we're good. Okay. In the 15 years since my diagnosis, I've had 2 major manic episodes, and I wanted to highlight some comparisons today and differences to show you what the outcomes can be based on the type of services that you're surrounded by. So when I was a sophomore in college, just about to turn 20, I was attending Western Washington University up in Bellingham. I started experiencing pretty significant behavior changes. I wasn't sleeping. I didn't have an appetite. I was acting very erratically, very out of character, very 1 minute really angry, 1 minute really elated, and life of the party. I was engaging in a lot of risky behavior. And I was doing a lot of very large, strange impulse purchases. I think at one point that winter I had like 7 fur coats in my closet, just to give you an example. But I was really unaware of how different my behavior was, but my friends and family were very aware and very concerned. So after one particularly disruptive and difficult night, they intervened and got me an appointment that next day at the Student Health Center at Western with one of the staff psychiatrists who specialize in working with youth. And through working with him, I was able to get a diagnosis. I got the medication I needed to stabilize my condition, and he ended up setting me up with a therapist who worked with young adults who had mood disorders. And I ended up working with that care team for 7 years through that first, the first initial years of a serious mental health diagnosis are so confusing and so nonlinear and so complex. And I am not saying that, the university system was perfect and it was ideal, but it was clear the path I needed to take to get care there. And without their support, I can't imagine how I would have managed through all of that. This was completely new to myself and my family. And so that was huge. In comparison, in 2019, I had, because of some miscommunications within my psychiatric care team, I underwent a medication change that significantly altered my moods and triggered a major manic episode. So unfortunately, I became convinced that I had been misdiagnosed with bipolar disorder and that I didn't need treatment anymore. So for several months, I cycled through pretty much every emergency department in Seattle every time I became suicidal. And during one particularly hard time, I attempted suicide by jumping off. I was going to jump off one of the piers at the waterfront. It was during a snowstorm in Seattle in 2019. But I got picked up by some EMTs and taken to the ER. I was strapped to a gurney and put in a hallway for 5 hours. And once and no one in my life knew I was even there. And once I got to a room, I was discharged within about a half an hour because I had someone that could pick me up and I could go home to. So basically what I got told every time is, you're doing too well to get a bed. You're doing too well. Here I am suicidal, but there's not really any treatment options. There's people much worse off than you. Because you have someone you can go home to, we have to discharge you, as if my mother or father knew how to treat someone with serious mental illness. So that episode lasted 10 months. And in those 10 months, I experienced significant trauma and loss. I lost jobs. I lost housing. I lost the trust and respect of friendship of lifelong friends. I experienced really bad physical ailments and illness, huge financial losses from all of the emergency stays, and huge personal losses. My best friends of over a decade were getting married that summer, and I was supposed to officiate, and I couldn't even go to the wedding because I wasn't able to. And these are the type of losses that you can't get back. Sorry. So I tell you all of this as an upper middle class white woman from the suburbs of Seattle. I've spent over a decade accumulating knowledge about the services in Seattle. I know this city very well. I know the organizations. I have an extremely supportive family. They have educated themselves through NAMI trainings on how to support me, and still I am unable to get the help I need when I am in crisis. I have tried to educate myself out of having another manic episode, but that's not possible. So if my question to all of you is, if I'm not able to get the help, who is able to? Who is getting the help they need right now in the system? And I want to be brutally honest with you, because I have so much skin in this game that throughout this 988 implementation process that I have been interacting with in the past year, I have unfortunately felt some similarities with this process in terms of the confusion and the overwhelm and misunderstanding of how this is all working. There's been similarities between that and how confused I felt trying to get support in the system. And I say that because it scares me, because every single day there are Washingtonians entering into crises like I have, that will have huge, long-lasting impacts on their life. And so I'm really hopeful that all of us can, there are brilliant change makers on this call. Every single person on this call gives me so much hope, and there's so much talent, and everyone that we need to make Washington the best crisis system in the nation is here. So I'm just so urging all of you. I can feel it in my bones that we have a once in our lifetime opportunity to make Washington the national leader on this crisis system. We need to take this opportunity. We need to set aside any differences. We need to see how we can reach across and create partnerships, how we can all work together beautifully. We need to dream up and really reach for that system that we think is even unthinkable, and we need to make it happen. And I know that we can, and I feel so hopeful, and I feel so honored to be with you all today. So I just thank you so much for allowing me to tell my story, and thank you so much for all of the time that everyone's putting into this. I know a lot of hard work goes into these meetings and the logistics and all the not fun stuff that happens behind the scenes. So thank you so much for letting me be here. And I am looking forward to the rest of this meeting. Thanks.
Melanie, thank you so much for sharing your story with us. Yeah, I feel really amazed at that stable 7-year care you had at the beginning, and I hate that I have to be amazed at that. And I feel not at all surprised by your second situation, which really frustrates me. And I want to echo Bapasha in appreciating your reminding us of the good trouble. And I want to remind everyone that we are here to try to change this system, to try to fix it. And I think it feels sometimes like, well, we don't know what to do next. I guess we'll do the same thing we've been doing, but that's not going to work. We have people here that we need to be supporting better than we are. So thanks so much, everyone, for being here.
Before we move on, I know Representative Orwell wanted to say a few words as well. So Representative Orwell.
I'm just so honored to work with you, Melanie. I think you were such a courageous leader, and we're so lucky you are here to encourage us, to prod us, to make sure we do the work to help people have a healing place, a safe place. And I know this process has probably been hard and frustrating, and I just want to thank you for sharing your story and being part of this amazing team of people, reminding us all the work we need to get done. So thank you.
I'm just reflecting on all of the stories we've heard over the past CRIS meetings and steering committee meetings. And Melanie, that was tremendous. So thank you for sharing that. And thank you for grounding us. And I'm going to be passing along a number of supportive and appreciative chats that I'm seeing here from members of our community who are reaching out to say how much they appreciated your words. So thank you for that. And I hope you get some better sleep tonight. Let's move on now. We're going to move into our CRIS updates. We have quite a lot of them since it's been 2 months. Let's start. We have an introduction for a new staff person, and I'm going to ask Carrie Waterland to make those introductions.
Thank you. Thanks a lot, Jamie. And thank you so much for giving me another tough person to go after, for sharing lived experience, and just again wanted to echo exactly what Representative Orwell said. So thank you so much for the honor of sharing, Melanie, your experience, your life, and your story. Thank you. I have the privilege of introducing a new team member to the governor's office today, and wanted to just say a couple of words and then hand it over to Megan for a quick hi, and then I'll bring it back to me for some HCA updates really briefly. But I'm really pleased to announce Megan Celedonia, who was appointed by the governor as the 988 Hotline and Behavioral Health Crisis System Coordinator. It's a big term. It's a big title. It's a big job. She joined the governor's policy office starting on April 18th. And Megan was, before coming to the governor's office, was the director of behavioral health transformation at the Behavioral Health Administration at the Department of Social and Health Services. She previously had several other positions at Behavioral Health Administration at DSHS, including time as the administrator of their project management office. She's been recognized with 2 different secretary coins. So anyone who knows about the coins, that's a very big honor. In behavioral health, they come from the corrections kind of world. And so kind of tying to that, those are huge honors, Megan. One of those coins was for creating a virtual reality training series to build a culture of empathy at the state psychiatric hospitals. And the other was for a team that worked on the system of care for individuals who are involved in the criminal legal system, who also happen to have a diagnosis of a mental health need or substance use disorder. So really, really big stuff. Megan also previously worked at our Department of Health for the state, including as their breast, cervical, and colon health program manager, where she really worked on managing grant programs and aimed at increasing cancer screening in Washington for individuals who are in a lower income bracket. And lastly, one of the really great things that Megan brings to this work is that she is a certified project management professional, and she's got a ton of experience managing complex projects. And we just really believe that she's going to be key to the success of CRIS, of the steering committee, of 1477 and the 988 implementation in Washington state. So please help me in welcoming Megan Celedonia. So Megan, I see you. And with that, if there's anything I may have left off, but welcome to CRIS, to the 988 Hotline and Behavioral Health Crisis System Coordinator role, and to today.
Well, thank you. And what a lovely introduction, Carrie. You said it all. I really appreciate that. I'm really excited to be here, everyone. I won't take much of your time at all, but I think Carrie gave you a good overview of where I come from, and what I'm looking forward to in working with this group is really helping us from a systems change standpoint, think about all of the pieces we need to move as we work together, and hope that I can be helpful in that effort. So thank you for the warm welcome, and I look forward to working together.
Wonderful. And Jamie, I will be quick about our updates for Healthcare Authority. But I think some of these folks may want to know these are really specific to the crisis services team at Healthcare Authority that's part of the Division of Behavioral Health and Recovery. So that team has been writing materials that they will be getting ready to share with subcommittees for some feedback and discussions on how to ensure that 1477 really works for all Washingtonians. So be on the lookout for some of those as those get shared. They've also been meeting with the Office of Insurance Commissioner, hi Jane, to have some conversations about how to implement those next day appointments for the crisis system for commercial insurance. And so there are some requirements of House Bill 1688. That's that balanced billing for out-of-network providers. And so really meant to bring commercial insurance carriers into that crisis and stabilization service realm. So the team has been working with the Office of Insurance Commissioner on that. On April 19th, they met with representatives from our behavioral health administrative service organizations, those BHASOs, to provide an introduction to the team. As part of 1477 and 988, the Division of Behavioral Health and Recovery got quite a few positions that will be helping to lift this work. So the team sat down with the BHASOs and had them introduce the new team members and all of the folks that are coming in for mobile crisis response team work. They provided an overview of mobile crisis response team standardization processes.